Hi, my name is Joanna Carranco. I chose the Native American culture. My presentation is called Native Americans' Beliefs and Practices, Biocultural Variations and Cultural Aspects of the Incidence of Disease. Some genetic or acquired conditions that are more prevalent in Native Americans are heart disease, cirrhosis of the liver, diabetes mellitus, fetal alcohol syndrome, cancer, and unintentional injuries. The leading cause of death is heart disease, and cancer would be the second leading cause of death among this group. Communication. Most of these individuals nowadays speak English along with their native culture, although older adults may need an interpreter if they speak their native language and haven't learned English yet. When speaking to them, it is important to give them enough time to answer, as they like to speak in a slow form with frequent pauses in between. And when greeting them, a light handshake and minimal direct eye contact is accepted. They consider it impolite when you make direct eye contact and you hold it for a while. They also like to prefer a distance of several feet. Cultural affiliations, sanctions, and restrictions. Native Americans like to refer themselves by their tribal name. Some also like to be referred to as indigenous. Both men and women are very modest, and nowadays their clothing is similar to the rest of the U.S. population. But traditional dress does include bright clothing for both men and women, and long skirts for women. They express their emotions, feelings, spirituality, and religious beliefs in a controlled manner or slow movement. They think that death is thought of as natural and is not to be feared. They believe that speaking of death is negative and should be avoided. They believe that to speak of those who have died may hold the person in limbo. The importance for family to be present when a family member is dying is very crucial, as they make decisions together in family meetings regarding end of care and types of treatments they should receive. Developmental considerations. Elderly adults are treated with utter respect and are cared for deeply by the family. Families consider it an honor to take care of them. And then an elderly adult role is important because their advice can help guide healthcare decisions. Economics and education. Poverty is a serious problem for some cultures today, and as Taylor stated, a report from the U.S. Census Bureau in 2014 noted that an estimated 15% of the U.S. population had an income below the poverty threshold. Of that population, the lowest income was found in African Americans, Native Americans, and Alaska Natives. Income and benefits in the Creek or Seminole tribe, according to the census, are out of the estimated 735 households, the median household income in dollars is $39,402. Estimated 45 households make less than $10,000, and an estimated of 127 make between $35,000 and $49,000, which is most of the households here. And then estimated 12 make $200,000 or more. Economic status has a big impact on Native Americans' health and living conditions. Access to care may be a factor in health disparities, although there are clinics on reservations, and some socioeconomic factors, such as high medication cost, could also lead to an increase in disparity. As stated in Lippincott, it is thought that if they have a higher educational level, it can lead to less health disparities, and if there is a lower educational level, it could be a factor of increased health disparities. Their culture does support community health for those living on the reservation, where most of their daily activities take place, such as school, clinics, and employment. Health-related beliefs and practices. They believe that illness is traditionally due to such forces as soul loss during dreaming, natural forces, spirits, spells, foreign bodies, and wounds. One of their practices includes putting an amulet on the baby, and as Lippincott stated, for protection, babies may be given amulets contained with tiny sacks of white cloth, and they're pinned to their shirt. They may also be given a necklace of white beads to protect them in their first years of life. Native Americans have medicine men or women, whereas other cultures rely on cultural healers. Traditional healing is conferred by medicine men and women, and the entire community is involved in the healing process. Medicine men and women would be the ones making the diagnosis, prescribing the treatment, whether it be a ceremony, song, fasting, sweating, and by creating medicine using herbal or animal supplements or sacred bundles of herbs and roots. Healthcare providers and nurses are accepted in their culture, but they wait until the last stage of an illness to seek medical attention. They view mental illness as a phenomenon and not an illness. Due to experiences that involve seeing visions or hearing voices may have spiritual meaning, so they don't think of it as an illness, really. And then mental illness is a culturally specific concept, and beliefs about causation may include ghosts, breaking taboos, or loss of harmony with the environment as well. Kinship and social networks. Family's composition varies in cultures. The Native Americans' culture households are often multi-generational, and they are often headed by women. Or it's common that they're headed by women. As the years pass, roles in societies change, and Native Americans share more roles today than what they were used to previously. Nutrition. Years ago, Native Americans used to hunt or farm to provide food for their family, and foods typically prepared in this cultural group are mainly soup and stew, and they use corn, which is the most important food, bean and squash, and often mixed together are referred to as the Three Sisters. They use fruit, pumpkins, nuts and seeds, and wild game like rabbit, turkey, wild pig, opossum, squirrel, deer, and raccoon. Religion and spirituality. They view death as a state of unconditional love in which the spirit of the deceased remains present, comforts the tribe, and encourages movement towards life's purpose of being happy and living in harmony with nature and others. They believe that medicine men or women can promote well-being or make the recovery from illness quicker. For those who have died, they have special rites and involves care of the body with rituals that ensure that the spirit can cross over to the spirit side. They also provide ceremony at the burial to keep going with the ritual until it is complete. To designate the end of mourning, a ceremony at the burial grounds is held during which the grave is covered with a blanket or cloth for making clothes. Later, the cloth is given to a tribe member. A dinner featuring singing, speech-making, and contributing money completes the ceremony. Values orientation. Some individuals can accustom to change really well and quick. Native Americans, especially the older adults, like to keep things like they're used to, so they identify strongly with their culture and fear that younger generations are losing traditional ways and language. As previously mentioned, Native Americans have medicine men or women to do their traditional healing, but they will accept Western healthcare practices during a pregnancy and childbirth. If there needs to be any changes to the body due to an illness or surgery, the need to ask questions about their practice is important. As mentioned in Advocate Health, if the person is in need of an amputation of a body part, ask what their tradition is and what they may require afterwards for the body part that is removed. Some may request that the body part be blessed and then followed by cremation in order to be buried with them at the time of death, or need it to be buried soon after surgery if the body part is not being cremated. In conclusion, knowing about different types of cultures and their customs is very critical, especially when taking care of them in the healthcare setting. We want to be able to provide the care that they need and that is appropriate for them, and that is by being aware of their cultural beliefs, practices, and diseases.